Hi everyone, welcome back. So today's topic of conversation has really come about as a result of me doing my women's health clinic and treating numerous women going through fertility issues, endometriosis, polycystic ovaries, and it's probably something that a lot of people don't know about, but it's something that we can do as therapists or that you can do as clients at home with maybe a little bit of practice. So I'm going to be talking about femoral massage. Now this it can be done twice a day. Now it would be recommended in the follicular phase of the menstrual cycle, so that means days 7 to 14, that time between the end of your period and ovulation. Or it can be used on the day before embryo transfer if you're going through IVF. However, the massage should not be performed after embryo transfer, or if you are, or if you think you might be pregnant. Now, one of the big benefits of massage in general is increased blood flow, and this means basically increased function of the organs, because you're also, by increasing the blood flow, you're increasing oxygenation and nutrition to the organ or the muscle, whatever it may be. So the sort of thinking behind femoral massage is that by increasing the blood flow around, in this case, around the pelvic area, the benefits seen from femoral massage are thought to be that this will help to maintain hormonal balance. So, you know, if you're someone, say, who suffers from really bad PMT, this could be useful, or PMDD as well, which I've done previously a post on, so do take a look at that. It is also thought to help improve egg health, and again this is due to the increased oxygen flow to the ovaries when the eggs are maturing. It is also thought to help reduce clotting during the menstrual cycle, so if you're someone who has really heavy periods, or maybe endometriosis, again, which I've done a post on previously, do take a look at that. This may help you. It can also help to assist the liver with detoxifying the body, helping to improve water retention and bloating, again, that you're going to get with things like PMT and endometriosis. And it's also thought that it can help to break up adhesions and scar tissues, again, particularly beneficial to those with endometriosis, or those who have blocked fallopian tubes. This may help. So, yeah, the main areas that femoral massage may be recommended is women who have fertility problems. Now this may be women who maybe have what's known as a tilted uterus. It may help, but also those going through IVF, as we've said, sort of using femoral massage the day before embryo transfer to really oxygenate those pelvic tissues and make sure that they have a good nutrition supply. But also women with polycystic ovaries, which I will be shortly doing a post on that as well. Endometriosis and dysmenorrhea, or sort of really heavy periods. Now, the first sort of thing you need to do, obviously, if you want to do this yourself, and it does take some practice if you're not used to looking for, you know, arteries in the body. First thing you need to do is locate the femoral artery. Now, the femoral artery is located superficially, so it should be quite easy to feel once you're sort of in the right spot, within the femoral triangle. So I'm going to show you where the femoral triangle is now. Okay, so this is when we talk about the femoral triangle. This is the area that you need to be looking at. So it's just literally sort of as you have that crease, sort of at the top of the thigh into the groin, that's where we're looking. Okay, so the femoral artery will be felt. So here on this diagram we're looking at the femoral triangle that I've just shown. So we are looking for the point at which the femoral artery, shown here in red, crosses the inguinal ligament. And this will be usually around halfway between the pubic symphysis and the anterior iliac, anterior superior iliac spine, which is that sort of hip bone, if you like. So it's usually around halfway along that crease, you know, that sort of goes into the groin. And this point is known as the mid-inguinal point. Okay, so if we look at this on a picture of an actual human, so as I say, it can, if you're doing this yourself, you know, without any experience of looking for arteries, it can take some practice. But yeah, so basically we are looking at, here in red, you've got the femoral artery. This is the crease of the groin here. So you're looking for the point at which that femoral artery in red crosses the inguinal ligament, which is this green line that runs across here. So that, in that circle there, that should be where you feel the femoral pulse. So that's the point that you are looking to apply pressure to. So as I said at the beginning of this video, you would probably look to do this exercise twice a day, and it should be repeated sort of 3 times. And this will help really just increase blood supply to the uterus and the ovaries. So first thing, you want to find that crease between the thigh and the trunk of the body, and then just use your fingertips, not your thumb, use your fingertips, and obviously from that diagram that I've just shown you, try to locate the femoral artery. Now you'll find this easier if you abduct the leg, so if you bring the leg away from the body, sort of out to the side, and you're looking for approximately the midway point, sort of between right down sort of where your genitals are, and your hip bone. It's going to be about midway. When you find the pulse, using your fingers, you're going to press down. Now you are going to have to press quite deep. Press down deeply into the artery until you feel the pulse stop. So you are going to have to press hard. And then you're going to hold that for 30 to 45 seconds, which will allow the blood to basically gather and pool around the uterus and ovaries. You're going to hold that for 30 to 45 seconds. And then you're going to release the pressure and allow the blood flow to resume naturally. Now at this point you may feel a kind of warmth as the blood returns into the leg. You're then going to repeat this on the other side. Gently massage the abdomen in clockwise rotations at the end. Okay, again, just sort of helping to stimulate that blood flow. And that's really it. So probably the hardest thing is finding the femoral pulse in the first place. But once you've done this a few times, I'm sure you'll have no trouble at all. Give it a go. You may find that it helps with either your symptoms from one of the sort of gynecological issues, or give it a go, as I say, the day before embryo transfer. I'm not going to say this is a miracle cure and you're going to do this and you're going to get pregnant, but it's certainly not going to do you any harm, and it's worth sort of trying anything, to sort of ensure that you're in sort of the healthiest condition possible, to give you the best chance of success. So I hope that is of use to you. As I say, there are already posts up here about fertility massage, about endometriosis, about PMDD, and I will be doing one, as I say, that will be going up very soon in the next couple of days on polycystic ovaries as well. So do take a look at those if they apply to you. Now, as always, feel free to comment down below or subscribe to my channel, or you can contact me via Instagram or Facebook. I'm on there as the Medical Massage Lady. If you are a massage therapist or student, I also have my Facebook page, the Medical Massage Lady Training School, and I will also have 2 new websites up and running very, very soon, so they will be advertised as well. Do get in touch and I will answer you. But yeah, that's really it from me on this subject. So just a quick one today, but I'll see you again next time.